This lecture is from Chapter 33, Topical and Inhalant Medications from MedSurg Fundamentals. Learning objectives. Explain how topical medications are administered and commonly applied. Name 2 forms of drugs applied by the transdermal route and principles to follow when applying a skin patch. Describe where eye medications are applied. Explain how the administration of ear medications differs for adults and children. Explain the rebound effect that accompanies the administration of nasal decongestants. Describe the difference between sublingual and buccal administration. Name a common reason for vaginal applications. Give the form of medication used most often for rectal administration. Explain why inhalation is a good route for medication administration. Name 2 types of inhalers and alternatives for administering inhaled medications. Drugs are administered by routes other than oral. This chapter describes the techniques used to administer drugs by the topical and inhalant routes. Topical route. Drugs given by the topical route, the administration of medications to the skin or mucous membranes, can be applied externally or internally. See Table 33-1. Topically applied drugs have a local or systemic effect. Many are administered to achieve a direct effect on the tissue to which they are applied. Percutaneous applications. Percutaneous applications are drugs rubbed into or placed in contact with the skin. They include ointments, patches, and pastes. Ointment applications. An ointment is a topical preparation rubbed into the skin for administration of a medication, also called oils, lotions, and creams. Alert clients may self-administer an ointment after receiving proper instruction. In that situation, the nurse teaches proper application techniques and checks that the client has applied the medication appropriately and as often as prescribed. For clients who cannot perform their own topical ointments, the nurse does so. See Nursing Guidelines 33-1. Nursing Guidelines 33-1. Applying a percutaneous application. Wash your hands or perform an alcohol-based rub. Check the identity of the client. Put on clean gloves if your skin or that of the client is not intact. Cleanse the area of application with soap and water. Warm the substance if it will be applied to a sensitive area of the skin by holding it temporarily in your hands or placing the sealed container in warm water. Shake the contents of liquids. Apply the percutaneous substance to the skin with the fingertips, a cotton ball, or a gauze square. Rub the substance into the skin. Rubbing promotes absorption. Apply local heat to the area if desired. See Chapter 28. Heat dilates peripheral blood vessels and speeds absorption. Transdermal applications. A transdermal application refers to drugs that are applied to and absorbed through the skin. Examples include skin patches and pastes. Skin patches. Skin patches are drugs bonded to an adhesive and applied to the skin for systemic distribution. See Figure 33-1. When applied, the patch stays in place for a number of hours and the drug migrates through the skin, being absorbed to maintain a consistent drug level in the bloodstream. Transdermal patches are typically applied to the upper body, such as the chest, buttock, stomach, and upper arms. The patch is marked with date and time of administration, and the location is documented in the Medication Administration Record, the MAR. Each time a new patch is applied, it is placed in a slightly different location. Clipping extremely hairy skin areas before an application may help adhesion. After initial application of a patch, it may take 30 minutes to 8 hours for the drug to reach a therapeutic level. Because scopolamine, a drug used to prevent motion sickness, is a small round patch, it is typically applied behind the ear. To maintain consistent blood levels of pain medication, fentanyl patches that are 100 times the strength of morphine are used around the clock. A nitroglycerin patch that is used to prevent and relieve chest pain is also used for 12 to 14 hours, then removed for the same amount of time. When removed, patches should be closed with the adhesive edges together, preventing accidental exposure to others. Teach clients to dispose of patches away from children and pets. Gerontologic considerations. The onset of drug action may be faster when administering topical medications to older adults because of their diminished subcutaneous fat, which leads to a more rapid absorption of topical medications. When clients are cognitively impaired, use the upper back for transdermal placement. This prevents the client from picking at and removing the patch. On page 781, figure 33.1, the pathway of absorption from a transdermal skin patch is illustrated. Applying a nitroglycerin paste. Wash your hands or perform an alcohol-based rub. Use 2 methods for checking the client's identity. Put on clean gloves. Squeeze the prescribed amount of paste from the tube onto an application paper. This is in figure 33.2 on page 781. This complies with the medication order, which usually prescribes the dose in inches. Fold the paper or use a wooden applicator to spread the paste over approximately a 2.25 times 3.5 inches or 5.6 times 8.8 centimeters area of the paper. These techniques facilitate distributing the drug over a wide area for quicker absorption. Place the application paper on a clean, non-hairy area of the skin. Cover the paper with plastic wrap, a transparent dressing, or tape all the edges of the paper to the skin. This seals the drug between the paper and the skin. Covering the application paper with plastic wrap or a transparent semi-permeable dressing is shown in picture B, 33.2 on page 781. Remove one application before applying another and remove any residue remaining on the skin. Careful application prevents excessive drug levels. Rotate the sites of medication placement. Site rotation reduces the potential for skin irritation. Remove the application if the client becomes flushed, hypotensive, or develops a severe headache. Nitroglycerin paste has a shorter duration of action than that supplied in a transdermal patch. Consequently, it must be applied more frequently to provide a sustained effect. Clients prescribed nitroglycerin in any form should not use a drug or herbal preparation for erectile dysfunction, because the combination may contribute to severe hypotension due to the combined vasodilation effect. Always use gloves when applying patches and pastes and wash hands with soap and water after glove removal. This prevents accidental absorption of the drug by the provider. Ophthalmic applications. An ophthalmic application is a method of applying drugs onto the mucous membrane of one or both eyes, described in Skill 33-1. The mucous membrane of the eyes is called the conjunctiva. It lines the inner eyelids and the anterior surface of the sclera. Ophthalmic medications are supplied either in liquid form and instilled as drops or as ointments applied along the lower lid margin. Blinking rather than rubbing distributes the drug over the surface of the eye. The eye is a delicate structure susceptible to infection and injury, just like any other tissue. Therefore, nurses take care to keep the applicator tip of the medication container sterile. Complex ophthalmic medication regimens can involve the installation of multiple types of drops up to 4 times a day. When more than one eye medication is prescribed, it is best to wait 5 minutes between installation of eye drops. For people having difficulty instilling eye medications independently, devices are available that can facilitate administration. Eye drop solutions should be disposed every 28 days to prevent bacterial contamination of the eye. Some older adults use 2 or more types of eye medications once or several times daily. If the caps of the eye medications are not color-coded, suggest ways to color-code the containers or distinguish them in some other way, such as using a rubber band on the container of one or to help differentiate the medications. When administering eye medications, it is important to ensure that the medication is distributed over the surface of the eye. The first instinct may be to rub the eye, but this would cause further trauma and irritation. Instead, have the client blink to distribute the eye medication. Otic applications. An otic application is a drug instilled into the outer ear. It is usually administered to moisten impact cerebrum, or to which is wax, or to instill medications to treat a local bacterial or fungal infection. If drainage is present, put on gloves and clean the ear with a swab or face cloth. Warm the medication container to minimize the client's potential discomfort. Manipulate the ear to straighten the auditory canal. The technique varies depending on whether the client is a young child. The nurse would pull the ear down and back, or an adult, the nurse pulls the ear up and back. See Chapter 13. Tilt the client's head away from the ear into which the medication would be instilled. Compress the container and instill the prescribed number of drops on the side of the ear canal rather than directly into the tympanic membrane. Press and release the tragus, the projection of the skin-covered cartilage at the opening of the external ear, to facilitate moving the medication toward the eardrum. Place a small cotton ball loosely in the ear to absorb excess medication. If a bilateral administration is prescribed, wait at least 5 minutes before instilling medication in the opposite ear. Briefly postponing the application within the second ear avoids displacing the initial instilled medication when repositioning the client. Nasal applications. Topical medications are dropped or sprayed within the nose. A proper installation is important to avoid displacing the medication into nearby structures such as the back of the throat. Adults often self-administer their own nasal medications, but sometimes nurses must assist older adults and children. Rebound nasal congestion, also known as rebound effect, rhinitis, results in nasal swelling when topical nasal decongestants are used more frequently than recommended by a client. Damage to the nasal passage from drug overuse can cause irritation of the nares and an inability to respond to the drug. This can happen when drugs are used more frequently than prescribed, and potentiated when people misinterpret the nasal congestion to be caused by a cold or allergy rather than the drug itself, and continue to use the drug to treat damaged nasal passages. Sublingual and buccal applications. A tablet given by sublingual application, a drug placed under the tongue, is left to dissolve slowly and becomes absorbed by the rich blood supply in the area. Some drugs in spray form are also administered sublingually. A buccal application, buccal, a drug placed against the mucous membranes of the inner cheek, is another method of drug administration. See Figure 33-5 on page 783. During sublingual or buccal administration, the client is instructed not to chew or swallow the medication. Eating and smoking are also contraindicated during the brief time needed for a solid medication to dissolve. Vaginal applications. Topical applications that are used most often to treat local vaginal infections. Vaginal infections are commonly and usually the result of colonization by microorganisms such as yeast that are abundant in stool. The microorganisms usually get transferred during bowel elimination if the client wipes stool from the rectal area toward, not away from, the vagina. Symptoms of a yeast infection include intense vaginal itching and a white, cheese-like vaginal discharge. Another common type of vaginitis is caused by a protozoan known as Trichomonas vaginalis, which is transmitted from an infected to uninfected person during sex. Several non-prescription antibiotic drugs such as Flagyl, Monostat, and Lotrimin are useful in treating vaginal yeast infections and are available in suppository, dissolvable vaginal tablets, gel, and cream form. Flagyl, metronidazole, Monostat, miconazole, and clotrimazole is Lotrimin. Again, are useful in treating vaginal yeast infections and are available in suppository, dissolvable vaginal tablets, gel, and cream. Early and appropriate self-treatment restores normal tissue integrity. Providing clients with instructions about how to administer vaginal medications for the most effective action may be helpful. Client and Family Teaching 33.1. The nurse teaches the client as follows. Obtain a form of medication based on personal preference. All come with a vaginal applicator. Plan to instill the medication before going to bed so that it can be retained for a prolonged period. Empty the bladder just before inserting the medication. Place the drug in the applicator. Lubricate the applicator tip with a water-soluble lubricant such as KY jelly. Lie down, bend your knees and spread your legs. Separate the labia and insert the applicator into the vagina to the length recommended. usually 5 to 10 centimeters or 2 to 4 inches. Depress the plunger once it reaches the proper distance within the vagina to insert the medication. Remove the applicator and place it on a clean tissue. Apply a sanitary pad if you prefer. Remain recumbent for at least 10 to 30 minutes. Discard the applicator if it is disposable. Wash a reusable applicator with soap and water when you wash your hands. Consult a physician if symptoms persist. Some older clients have difficulty reaching areas of the body to which topical drugs are applied. For example, arthritis may interfere with applying medication within the vagina or rectum or to skin lesions on the lower extremities. Rectal applications. Drugs administered rectally are usually in the form of suppositories. However, creams and ointments may also be prescribed. The technique for using a rectal applicator is similar to that of using a vaginal applicator. See page 784. Question: is the following statement true or false? The conjunctiva lines the inner eyelids and the anterior surface of the sclera. This is true. The mucous membranes of the eyes, called the conjunctiva, lines the inner eyelids and the anterior surface of the sclera. Question: is the following statement true or false? In a sublingual application, medication is introduced into the bloodstream by dissolving or mixing medication in water and ingesting thereafter. This answer is false. In a sublingual application, the drug is placed under the tongue and is left to dissolve slowly and become absorbed by the rich blood supply in the area. Transdermal application and review refers to drugs that are applied to and absorbed through the skin. Examples include skin patches and pastes. Skin patches are drugs bonded to an adhesive and applied to the skin for systemic distribution. When applied, the patch stays in place for a number of hours and the drug migrates through the skin, being absorbed to maintain a consistent drug level in the bloodstream. See page 781 for an illustration. Transdermal patches are typically applied to the upper body, such as the chest, buttocks, stomach, and upper arms. The patch is marked with date and time of administration, and the location is documented in the medical administration record called the MAR. Each time a new patch is applied, it is placed in a slightly different place. Clipping extremely hairy areas before an application may help adhesion. After initial application of a patch, it may take up to 30 minutes to 8 hours for the drug to reach a therapeutic level. Because scopolamine, a drug used to prevent motion sickness, is a small round patch, it is typically applied behind the ear. To maintain consistent blood levels of pain medication, fentanyl patches are 100 times the strength of morphine and are used around the clock. A nitroglycerin patch that is used to prevent and relieve chest pain is used for up to 12 to 14 hours, then removed for the same amount of time. When removed, patches should be closed with the adhesive edges together, preventing accidental exposure to others. Teach clients to dispose of patches away from children and pets. Refer to Nursing Guidelines 33.1 and Nursing Guidelines 33.2 for directions on teaching and applying. Page 780 and page 781. In review, eyes. Application onto one or both eyes is ordered. Different forms of medication need to be marked and clearly for the patient to be able to distinguish between them. Ears, the different techniques of administration differ for adults and children. Adults is up and back, children is down and back. Question: is the following statement true or false? When instilling ear medications in a young child, the nurse pulls the ear up and back. This answer is false. When instilling ear medication in a young child, the nurse pulls the ear down and back. For an adult, the nurse pulls the ear up and back. In review, nasal applications. Topical medications are dropped or sprayed within the nose. See Skill 33.2. A proper installation is important to avoid displacing the medication into nearby structures, such as the back of the throat. Adults often self-administer their own nasal medications, but sometimes nurses must assist older adults and children. Rebound nasal congestion, known as rebound effect, rhinitis medicamentosa, results in nasal swelling when nasal topical decongestants are used more frequently than recommended by the client. Damage to the nasal passage from drug overuse can cause irritation of the nares and an inability to respond to the drug. This can happen when drugs are used more frequently than prescribed and potentiated when people misinterpret the nasal congestion to be caused by a cold or allergy rather than the drug itself and continue to use the drug to treat damaged nasal passages. In review, sublingual and buccal administration. A tablet given by sublingual application is a drug placed under the tongue, is left to dissolve slowly, and becomes absorbed by the rich blood supply in the area. See Figure 33-4. Some drugs in spray form are also administered sublingually. A buccal application is a drug placed against the mucous membranes of the inner cheek, is another method of drug administration. See Figure 33-5 on page 783. During sublingual or buccal administration, the client is instructed not to chew or swallow the medication. Eating and smoking are also contraindicated during the brief time needed for a solid medication to dissolve. Vaginal applications. Topical applications that are used most often to treat local vaginal infections. Vaginal infections are commonly and usually the result of colonization by microorganisms such as yeast that are abundant in stool. The microorganisms usually get transferred during bowel elimination if the client wipes stool from the rectal area toward, not away from, the vagina. Symptoms of a yeast infection include intense vaginal itching and a white cheese-like vaginal discharge. Another common type of vaginitis is caused by a protozoan known as Trichomonas vaginalis, which is transmitted from an infected to uninfected person during sex. Several non-prescription antibiotic drugs such as metronidazole, which is called Flagyl, miconazole, which is Monostat, and clotrimazole, which is Lotrimin, are useful in treating vaginal yeast infections and are available in suppository, dissolvable vaginal tablets, gels, and creams. Early and appropriate self-treatment restores normal tissue integrity. Providing clients with instructions about how to administer vaginal medicines for the most effective action may be helpful. If the client cannot self-administer a vaginal medication, the nurse wears gloves to avoid contact with secretions. After removing the gloves, hand washing or an alcohol-based rub is critical. The same advice holds true for rectal applications. Rectal applications. Drugs administered rectally are usually in the form of suppositories. See Chapter 31. However, creams and ointments also may be prescribed. The technique for using a rectal applicator is similar to that of using the vaginal applicator. Some older clients have difficulty reaching areas of the body to which topical drugs are applied. For example, arthritis may interfere with applying medication within the vagina or rectum or to skin lesions on the lower extremities. For directions on rectal applications, the same as for vaginal is in the Teaching 33-1, page 784 in your Fundamentals book. Inhalants. The inhalant route administers drugs to the lower airways. This method of medication administration is effective because the lungs provide an extensive area from which the circulatory system can quickly absorb the drug. A simple method of administering inhaled medications is through an inhaler. Inhalers are handheld devices seen in Figure 33.8 on page 785 for delivering medication into the respiratory passages. They consist of a container of medication and a holder with a mouthpiece through which the drug is inhaled. See Figure 33-8. There are two types of inhalers. One, a dry powder inhaler, holds a reservoir of pulverized drug and a carrier substance. And two, a metered dose inhaler, called MDI, that delivers aerosol medication, which is a liquid drug forced through a narrow channel via chemical propellant. Traditionally, metered dose inhalers have been propelled with chlorofluorocarbons, which contribute to environmental pollution. Current global regulations require them to be formulated to contain non-ozone depleting substances. Dry powder inhalers depend on the client's inspiratory effort to deliver the medication into the lungs. If the inspiratory effort is ineffective, the dose of the drug is reduced. A metered dose inhaler contains medication under pressure within a canister. The canister is placed into a holder containing a mouthpiece. When the container is compressed, a measured volume or metered dose of aerosolized drug is released. Clients who use metered dose inhalers do not always do so correctly. As a result, they may swallow rather than inhale much of the medication. As a result, their respiratory symptoms may not be relieved. See Client and Family Teaching 33-2. Some clients find that the inhaled drug leaves an unpleasant aftertaste. Gargling with salt water may diminish this. Drug residue may accumulate in the mouthpiece. Therefore, the clients should rinse the mouthpiece in warm water after use. Definition of inhalers. Inhalers, drugs, administer drugs to the lower airways. The dry powder inhaler holds a reservoir of pulverized drug and a carrier substance. A metered dose inhaler delivers aerosolized medication, which is a liquid drug forced through a narrow channel via a chemical propellant. Sometimes two inhalers containing different drugs are prescribed. During teaching sessions, it is important to educate how and when each drug is used and the anticipated action. For example, one drug may act to expand the bronchioles and would improve the overall outcome to be administered before a medication that loosens secretions. Providing simple written instructions with each medication is also helpful. Monitoring the heart rate and blood pressure of older adults who use inhaled bronchodilators is important because these medications commonly cause tachycardia and hypertension. Either or both of these effects increases the risks for complications, especially in older adults with an underlying cardiovascular disease. Client and Family Teaching 33-2, using an inhaler, page 786. The nurse teaches the client and the family as follows. Insert the canister into the holder. Also check the expiration date. Shake the canister to distribute the drug in the pressurized chamber. Remove the cap from the mouthpiece. Tilt your head back slightly and exhale slowly through pursed lips. Place the inhaler in your mouth and close your lips around the mouthpiece, or place the inhaler 1 to 2 inches away. Press down on the canister once to release the medication. A metered dose inhaler can be used by holding the mouthpiece 1 to 2 inches away prior to depressing the canister and inhaling, or the mouthpiece can be placed in the mouth and sealed by the lips to administer the drug. As the medication is released, breathe in slowly through your mouth for approximately 3 to 5 seconds. Hold your breath for 10 seconds to let the medication reach your lungs. Exhale slowly through pursed lips. Wait 1 full minute before doing another inhalation if more than one is ordered. Clean the inhaler holder and mouthpiece daily by rinsing it in warm water and weekly with mild soap and water. Allow the inhaler to air dry. Have another inhaler available to use while the first one is drying. Check the amount of medication in the canister by floating it in a bowl of water. The higher the canister floats, the less medication it contains. Obtain a refill of inhalant medication when the current canister shows signs of becoming empty. Clients who have problems coordinating their breathing with the use of inhaler may not receive the full dose of aerosol. A spacer is a chamber attached to an inhaler. Figure 33-9 on page 786 shows you an illustration, a picture. Using a spacer can be helpful in this situation. Spacers provide a reservoir for the aerosol medication. As the client takes additional breaths, he or she continues to inhale the medication held in the reservoir. This tends to maximize drug absorption because it prevents drug loss. Some clients also find that prolonging inhalation of the drug reduces side effects such as tachycardia or tremors in your hands. Some clients, such as infants, young children, and older adults who have difficulty coordinating inspiration with the use of a handheld inhaler, may use a nebulizer as an alternative to administering an inhalant. A nebulizer, sometimes called a breathing machine, is a device that converts liquid medication to an aerosol using compressed air. The aerosol is inhaled through a mouthpiece or a face mask over 10 to 20 minutes until the mist is no longer visible. The components of the nebulizer are cleaned after each use with soapy water and a small brush. After rinsing the clean parts, they are allowed to air dry before storing them in a closed container. Question: is the following statement true or false? Drug residue accumulates only in the mouthpiece of faulty inhalers. This answer is false. Drug residue may accumulate in the mouthpiece of all inhalers, so the client should rinse the mouthpiece in warm water after use. Nursing implications. When administering topical or inhalant drugs, nurses often assess and take steps to maintain the integrity of the skin and mucous membranes. Health teaching may be important to prevent improper self-administration. Nursing diagnoses may include the following: deficient knowledge, readiness for enhanced knowledge, impaired gas exchange, impaired skin integrity, impaired tissue integrity, ineffective breathing patterns. There's a picture of a nebulizer on page 787, figure 33-10. A nebulizer consists of a cup to which liquid medication is added, a mouthpiece and tubing that connects to an electric or battery-powered source for compressed air. This is the end of the slideshow.